Okay. Hi, good morning. So we'll start our session. First session is by our the professor on SLO9.
So can you see my screen? A single screen or double screen?
Yeah, we
Single
can
screen, sir.
see.
Okay, good morning, everybody. Hi. This is a difficult topic, at the same time, very much needed topic. So SLO9 on the new curriculum says support the juniors, supervise and educate. Today, I'm going to concentrate on the third word, educate. And that also maybe mainly on when you are preparing a teaching session, what are our objectives? What do we have to do when we prepare a teaching session? So we'll take through basic concept and hope by the end of this session, when you're preparing next lecture or teaching to come here, you think a little bit on this line, and then of course hopefully it will be useful. Okay, so the next 3 minutes. So next 3 minutes, can you see the task one on the screen?
Yes, sir.
So you guys are planning to give a teaching session to DVTS consultants. The topic for the teaching session is importance of signing workplace-based assessment on time, because you had enough of the consultant not signing your workplace-based assessment. So how are you going to set your objectives? What are you going to talk? So in next 3 minutes, just write down on a piece of paper or whatever you have in front of you, what exactly you are going to teach. The teaching time is 30 minutes. So in 30 minutes, you have to deliver this teaching. So your audiences are DVTS consultants. And the topic is importance of signing workplace-based assessment on time. So if you were planning a teaching, what we would do? Okay, some of you who wants to talk can start talking. What did you plan?
Sir, I'd like to say something.
Okay.
First of all, I would I'd like to introduce the curriculum and checklist of the ARCP that we have been targeted. I'd like to introduce all the checklists and a purpose of getting the WPS done at our point. And our training structure, I will introduce our training structure, how it goes, which years we are posted, and how this training structure have been planned. And I will give my appreciation to all the consultant on behalf of completing the WPBAs. Thank you.
Okay. Anything else?
That is what I thought, sir.
Anybody else? Anybody?
I can try.
Okay.
I was
I wrote
thinking
four,
potentially to then say
As gone. As
so I wrote 4 points for objective. What is WPBA and how to do it would be the second point. Third would be why is it important to all trainees and for the consultant. And fourth would be how to improve the current approach or say the current how it has been done. I
Okay.
included 4 points.
Any other views?
I've got a little separate view.
Okay. So
As Prajwal mentioned, probably making aware that there is a checklist and this is something for your further advancement in your career, that would make them more aware. Second thing is like, how does the portfolio work? So whether the consultant actually has got a portfolio to sign you off when he receives the ticket or not, and inform that this particular case that I've seen, I will be sending you a ticket and acknowledge their commitment from their side. It's understandable that they will be a bit time consuming because of their own priority sometimes. And second thing is, I wrote it in a step way fashion. So I said, ticket send on time with enough details. And the third one is check if has been signed or not. If yes, send a thank you note. If no, email a note saying that I'm still waiting for you to be signing my WPBA, plus verbal reminder while on the soft floor, plus ask for his admin time if we can actually finish while he was on the soft floor.
So that is what you're going to teach on this teaching session, yeah?
Yeah.
Okay. Okay. Any other views quickly? So before I move on. Boon.
Just want to comment one thing. This particular session is trying to convince the consultant to sign the tickets on time.
Yeah.
The most important thing to get them to sign it on time is, to me, because even consultants are humans, what is in it for them? Why should they do, what is the benefit to them for signing it on time? In reality, the benefits to you are great, but unless the consultants are sort of focused on helping you to progress your training, which unfortunately will not cover the majority spectrum of who we have, then what you really need to be looking at is what is it is for them. And I would be thinking along the line of, if you sign it on time, you're gonna help improve the quality of the trainees, because there's a feedback. The whole point of these sessions is these tickets is a training opportunity. You're gonna improve the workforce that you have. You're gonna improve the people, the trainees, the quality of the trainees on the shop floor on your shift. It's gonna make your shift easier because your trainees are better trained. And number two is, the trainees are here to progress, and if you show evidence that actually you're helping to progress the trainees training development, then really you will help improve the retention rate and or a retention rate. And also, if there is then a reputation or culture of the consultant in the department actually actively doing the tickets on time, then you then start to have a potentially improved recruitment rate. So that to me is the important 2 points to try to convince the other person, especially one where there is a mismatch of power, because the consultant has much higher, much higher level of influence and power compared to who you are, and you're trying to influence them. That's all I want to say. Thank you.
Okay. So see, this is not our topic today. So, but what I was going to bring here is, even planning one session on one topic, different people would approach it differently. Okay. So I wish I could talk more about consultant not signing it and what we need to do, but that is not our topic. So what I'm focusing today is whenever you plan your teaching session, I don't know whether you are doing currently or not, you have to list your objective, you divide your time and plan how are you going to use your 30 minutes, 35 minutes in teaching. So 5 minutes I'll do this, another 5 minutes I'll do this, another 10 minutes. So that is what I want you to do when you're preparing next lecture. So bring a piece of paper out and then draw your timeline, what you're going to do and how you're going to do. That is what we would discuss today. Okay, a little bit to guide you. And the consultant signing is not my topic. It was just an icebreaker to bring you to the topic. So the objective of today is to help you setting objectives for teaching session. Okay, that is my sole goal. And when you are preparing a teaching session, just don't Google around, get the topic and put few slides and come and talk. You have to think certain things that will help your teaching to be better. So that is what is the objective today. So setting learning objective for your teaching session. So what do you think you need to do to set an objective, to plan your session? What are the things you would consider? Anybody?
Yeah, so
Sundar, yeah.
we have to think about the audience. So
Yes,
audience
absolutely. Anything else?
and time as
Yeah,
like
time, very good. So any other views, any other things to add? Okay,
So look at the curriculum.
yes. So if you Google like small group teaching, you'll find loads and loads of tips and helps and guidance. I don't want you to be flooded with all that, but what I want to emphasize, it is a very big area. Small group teaching.
I think the sorry to interrupt. I think other important thing is because when you're teaching, so you have to have a bit of credibility built up, because I mean the teaching is a very funny thing. Is a very old way to communicate to people. Now, I mean, if the same thing is said by a shepherd and by a professor, you see there's a lot of difference in it. So you have to have a credibility set up. I think first of all, you have to introduce yourself, that who are you or what, very important, because then you attract the people attention. And then of course you go with the usual stuff, so objective, what the definition is, the topic and audience, all the stuff, and the environment of the presentation.
So yeah, absolutely right. So what you have to do before you start teaching, or before you prepare your teaching, before you decide what slides you are putting, pause and have a 5-10 minutes to plan it. So I have 35 minutes to teach. I'm going to put one slide here, one slide there. This is the area I'm asking audience question here. That planning is very important. And what do you put into your planner? These are the different things you can put into your planner. What knowledge I'm going to deliver? What are the slides? Am I using some photos or diagrams or group discussions? What I'm going to do? So the lesson planning process has to be clear. And also you should plan well in advance, not the same morning. You should have clearly defined session objectives and outcomes that Aftab was saying. You cannot talk like if it is anaphylaxis, talk everything. No, you have to think of your audience, like Sundar was saying. These guys are just CT1 doctors. So I have to talk to them like a CT1. These guys are ST6 doctors, almost consultants. I have to talk to them like a consultant. So when you have a range like this, a group from way early, like HIEM 3s to people like Boone and all who are ST6 about to be consultant, you have to put little bit for everybody. You can start basic, so it will be useful for junior ones, then build on a little bit, then it will maybe useful for intermediate one, then go on to higher level, and then maybe something for us as well. So this you have to plan. So that the EMTU, our teaching process, is very And we have range of almost 6 years of competencies here. So whenever you're putting on things, your audience factor is very important. So put questions or contents in such a way that everybody takes something home. The other thing is the curriculum. What is the curriculum on that topic? So whenever you are in 2015 curriculum, it was easy because there was a section of what is the knowledge expected on that topic. In 2021 curriculum, that section is gone. We don't have that section. We have loads of topic, and then we don't know what is the depth. So the way to identify them would be probably going to the HIEM website on that topic, if there is something, or any other emergency medicine website, or standard textbooks like Rosen or any Oxford handbook to start with. So you have to find the range. Every curriculum has a range from basics to higher level. And then you have to set out what I'm going to teach, what are my outcomes at the end of this session, and how I'm going to do. Am I going to have a MCQ or a group discussion, or I'm and then you also, it is a good practice to have a pre and post teaching MCQs if you can. If not, something to assess at the end, to ask 1 or 2 questions whether they have understood your teaching or not. So there has to be, you have to have some assessment tasks as well as a part of your planning session. And the next thing is student participation. And this is all coming from our new curriculum. So how will you create student participation in your teaching? What have you done so far to encourage student or audience participation?
Like multiple choice questions.
Yeah, you can have multiple choice questions so that I get attracted towards the question, and then
CPD points.
What did you say, Sambu?
CPD.
Yeah, CPD points can help. But how will you make sure that the participants are discussing during the process of teaching? They are actively listening to you.
Showing the pictures by increasing the curiosity. So
yeah, you can have some pictures and ask questions on that one. And you can pause and ask a direct questions saying, Manas, can you answer this? So that others will also be alert. Or as Sundar said, put an MCQ there, put a photograph there. Whatever you do, your teaching session should make sure there is a student participation happening. So when you're planning your teaching, you have to plan. See I've told this many times, the attention span is around 15 to 20 minutes. If your teaching is really good, they will listen to you for 20 minutes. If your teaching is really good. If your teaching is boring like mine, maybe 5, 7, 10 minutes. So what you have to do, every 5, 7, 10 minutes, you have to pause and ask question or do something so that they wake up again and come back to your teaching. So this is very important. So if you are planning a teaching, you make a rule in your head that around 15 minutes time, I have to change something. I have to put a photo, or around 15 minutes time. So if you are doing a 30-minute session, at least you should have 2 student participation breaks, not a break as such, but events that you bring in 2 photographs or 2 something. Why this is important? Everybody has to participate in the process, isn't it? Everybody. We should create an environment in which everybody gets opportunity to learn, and if there is a question to ask, the process has to be together to explore in depth different viewpoints. Like today, Aftab said something else, Suraj said something else. So the different viewpoints coming to it, like Boone said something else. The different viewpoints should be accommodated within the session as well. And there are people who always raise hand and talk. Is it a good thing or a bad thing?
I think talking is a good thing. Now, this coming to the previous point Prakash is discussing. Now, PBL, problem-based learning. So this is a massive set of thrust now in the modern learning practices. I think the topic, if possible, should be advertised beforehand. So if we know the audience, like we have a group here, so the topic should be advertised beforehand. So people should have a chance to go and study and assimilate before coming to the discussion. Then I think, I don't know, we can't do that because of the
No,
time
we are
constraint.
doing it after, because I think
No,
my
but I mean,
my
no,
topic was advertised yesterday, day before, sometimes, isn't it? Monday,
yeah,
no, Tuesday.
yeah, you're right. But again, I mean, probably we give the each and every, if it's practical, for few minutes, like 2, 3, 5 minutes, to express in short on the topic which is in hand. And the speaker, I think it's a good system, the modulator and stuff like that. And the speaker then can summarize it. So I think, to me, this is a very good learning set of experience, because then the people don't have to go and encumber books, because a lot of stuff will be staying in the mind for the exam and the discussion, and everybody has an equal opportunity to learn and talk on each and every topic. I don't know whether we could, put in our group that sort of method or not.
Okay, thank you. So coming to my question, somebody answers most of the time when you ask the questions in the group. Why some people answer and some people don't? Or that is the question one. Is it good thing that only one or few people are answering to the questions? What do you think? Like, some of you will never answer if I don't ask you directly.
I think, good morning.
Yeah,
I
all
think
right,
it's
go
not
on.
a good thing that one person or two person are answering,
Mhm.
because then the whole participation will not be there. So it's a good practice if whole of the group was involved, and one person who's been answered, that person needs to speak again after a short period of time, give chance to other people, because it's some people are inhibited, they don't try to speak. If someone else jump in and speak, so they need to put the balance. That is this what I feel.
Okay, so the reason is some of us are like active learners who learn on the go. So those people who answer you quickly are active learners. Some of us, like me, are reflective learners who first take the content in, digest in my head, understand it, then only talk. So I am the one who will not answer to the question if I am on a teaching session. The reason being, I am not shy, but I am reflective learner. It takes time for me to understand the process and put it in my head, and then bring it out. So some of us are shy, very unlikely in this group, but in a new group where you don't know each other, you could be shy as well. But the most important thing when you're presenting is you should accommodate all of them. If somebody is shy or not talking at all, then you may have to say, Sambhu, what is the answer to this question? And then he comes forward. If somebody is a reflective learner, you may have to give them a little bit of time. These reflective learners usually answer the question at the end of the session, because they have understood, there is understanding now. So if the active learners start answering quickly in the beginning of the session, maybe towards the end of the session, you may have to then say, and what is your view, Suchit? Because he is one of the reflective learners, I know. So then Suchit will then, he has his view. Always Suchit has his view, isn't it? But he doesn't talk. And then initially I used to think, oh, Suchit, does he understand anything? But when you ask question, and you'll find out he understands more than anybody else. So that is how. So you have to understand your audience. And when you're planning a session, today we're talking about planning a session, you have to consider these type of things as well. So I may be asking direct question. I may be asking questions to somebody who is not answering initially. What do you have to do? And to reach this goal, you may have to encourage people who don't talk. You may have to stop people who are talking too much. So that is what you have to do. Sometimes you will find one person answering 4, 5, 6 times, and they say, okay, now let me ask somebody else. I've listened to this, I've heard you. So this is what you have to think. So when you're planning, you have to plan for, this is the adult learning process. So if you go and Google the theories of adult learning, we can keep on talking for another 1 month. There are loads of psychological theories, educational theories, how adults learn. We learn differently to the children, school children. So the way we have to train ourselves is also different. So that is another thing you should think of. So the other thing in your planning is you should have a clear-cut goal. I am teaching this because I am only given 35 minutes. I cannot complete my SLO9 completely today. So I am only doing part 1. The second part, I'll keep it for my next lecture. So that is how I planned this one. So you should have a goal. If I was doing all SLO9, I think I would be rushing through. I think I will not be taking all of you together. So that is why I had to split the session. That is why you should have a clear-cut goal. And the learning outcome is very, very important in planning your session. And there are 3 questions you have to ask. What is my learning outcome? Why is the learning outcome there? Because this is a target for CT1 doctors or ST3 doctors or higher specialty doctors. For us, when we are teaching SLOs, each SLO has 3 levels. Level for juniors, level for intermediate ones, and level for senior ones. So each topic you teach, henceforth, maybe you have to have 5-10 minutes for the beginners, another 5-10 minutes for the intermediate one, and another 5-10 minutes or at least 5 minutes for the senior one, so that everybody gains something. So you have to think of this, once you decide what you are going to teach, then you have to think of how are you going to teach this? Are you going to demonstrate some practical skills? Or are you going to talk theory around it? Or are you going to bring a group discussion? How are you going to do this? And that is the next thing you need to know. Your learning outcomes are very important. So to summarize so far, while setting objectives, you have to think of time. You have to think of audience. You have to think of requirement, what is required by the curriculum, and you have to think of method of delivery. So this is just before you start doing anything. So I have for 35 minutes or 45 minutes, whatever, we have 35 minutes for this teaching, isn't it? So I have 35 minutes. My audience is HIEM and Caesar. My requirement is I have to hit the target set by RChem 2021 curriculum. And I'm going to do a PowerPoint presentation and maybe a little group discussion in between. So that is my method of delivery. Today, I'm not asking MCQ or doing anything because it's difficult to make an MCQ in this type of topic. Okay, so let's go step by step, a little bit further. There are 6 mini steps you can follow. Step 1 is introduce your topic. So like today, I introduce with a group discussion. You can introduce by a photograph. You can just write a big bold topic. You have to introduce your topic. You can have an audio visual aid. So within first 2 to 3 minutes of your time, you introduce your topic. And during that time, you can lay your objectives, what you're going to teach today. And you can ask the students, what is your understanding about this topic? If you do all this, if you bring a very attractive introduction, it will pull your audience towards you. That you give a little thrill, that is what that will be, oh, today I'm going to learn something new. So they would be interested towards you. So that is the step 1. So whenever you're preparing for a next teaching now, think, how are you going to introduce you? Most of us just say, today I'm going to teach anaphylaxis or abdo pain, and then you crack on with your topic. There has to be a little pause, 2 minutes for a little thing that you attract the audience towards you. It is always nice to know what your audience knows. So that is second part. So you can do a pre-teaching MCQ. You can ask them, what is your view on this topic? What is your experience? So that you know before you start what your audience really know. This is important in two sense. One is you might have brought loads of things to present on that day, but when you discuss initially, you find that most half of your topic that you have brought, they already know anyway. So there's no point in spending loads of time in those slides. So you can quickly flick the slides and spend more time on the slides that they don't know. Okay, so though you have prepared loads of slides for the topic, and when you have this first session to know, initial part, to know their knowledge, you may then plan how to use time on your slides. And then you have to think when you're planning, what are the content of my main topics? There are loads of things to look in that. Your main topic, what is your theme? What are the subtopics you are talking? Are you using PowerPoint or flashcards or charts? How are you going to deliver? And then how are you linking your main content to the objective or the curriculum? So that is a step 3. And then, of course, you have to have a controlled practice that this is mainly applicable to some practical skills you are doing, or you can have some discussion around it, some activities around it. That also you have to put in your planner. And then obviously at the end, when you finish on your time, then you say, do you have anything further to discuss? So if your presentation is, say, for 45 minutes, that's why we have 35 minutes of teaching, talking from the presenter, and then 10 minutes of discussion. This discussion part is very important. Sometimes they won't bring anything in discussions. It is your duty to plan. If nobody speaks in discussion, I'm going to bring out this topic so that the discussion starts. Sometimes your presentation itself will bring your discussion. But if nobody is talking, then we don't finish 10 minutes early, but I will bring out something to discussion. And at the end, you should think of a quick review and follow up whether they understood the concept that you were trying to bring today or they haven't. But going back to the topic, let me come off this. So today's main focus was getting you ready for teaching planning rather than anything. So it's not very complex topic. This we do maybe every year. All of you would be teaching 2-3 times, but I don't know how many of you so far were planning your session. So what is your thought? Have you been planning your session? How did you do teaching so far? Anybody? Patrick, are you there?
Yes.
Yeah.
Can you hear me?
Yeah.
Yes. Well, I think the problem is making assumptions about the fact that you are actually speaking to the converted, as it were. So if you've got HIEM 3s, you've got Caesar doctors and consultants. Already you've got the critical stratum of the knowledge base there. So you might not even have to, you take a lot of things for granted that, when I'm calibrating my topic, people have got to know this, have got to know that, and so forth. But your point of bringing in all these things of introspection, questions, setting in MCQs in the mix. And so because you don't get lost, because you assume that you've got an audience of 20 people and not everyone will follow you through. So it might be just like a symbolic exercise where people are just saying, well, I'm attending a Thursday teaching without really participating in it. But also at the same time, I disagree with the point of one of the former speakers who said, well, if there's someone who's showing keenness in the topic and raising their point all the time. At times that can also help direct the discourse, because if you have got Mr. J in the mix here, he tends to direct, to focus the discussion in a direction where, you know, you think, well, I think there's lateral thinking here and so forth. So it's not a disadvantage to have someone who is actually knows the topic a lot and is asking a lot of questions and is participating more than others, because that can actually help others who are really probably not picking up as much detail as possible.
True. The issue I was raising was, if somebody is talking or answering all your questions all the time.
Yeah.
So as a presenter, you may have to say, okay, thank you, Ankit, or somebody who is talking.
Yeah.
I have, thank you for answering so much. Can I this time, can somebody else answer, please? So that you bring the wider group into discussion. Obviously, people who talk bring another perspective to the discussion anyway.
Yeah.
So you are right.
Yeah.
So if Mr. J is coming forward every time, that means he has his own experience and his own perspective to the topic, isn't it? And then that we will learn, obviously. But if he is talking, if he is the only one talking all the time, then that may not be right.
Well, I understand your point.
So guys, my question has not been answered. My question was, how many of you so far, when you were preparing a teaching session, did plan in a piece of paper, I'm going to use 10 minutes for this section, 5 minutes for this section, here I'm going to ask a question. How many of you planned for 5 minutes before you drew or you put the slides together?
Well, well, me, I plan the sessions. I very, but I think I not do very well in the way that I just centrated in the acknowledge, no in the acknowledge, no in the what the people in that moment or the audience need, no. Sometimes, yes, I did some teaching that I get involved the audience, and of course I don't like the test, because there's I mean the knowledge need time to keep in brain. I just like to just focus and give so very try to give message, some message that they can keep, but then they need the time to process that, no. And then just but I think it's important to see these points, no, to have 5 minutes, 10 minutes in this, 5 minutes in that, because maybe you can catch more in the from the audience. I plan, but in different way.
Say the new HIEM curriculum highlights this as one of the SLOs. So as an emergency medicine consultants, we are expected to educate. This is educate, supervise, and support. So my other sessions, I'll be probably next time I'm talking mainly on supervision. What are the different aspects of supervision? It doesn't have to be, you don't have to be a consultant to start supervising. If you are tier 3, you may be supervising tier 2s. If you are a second year HIEM doctors, you may be supervising first year HIEM doctors in a unofficial capacity. They will come to you and ask you questions, and you are answering. And those little skills, that is the probably next topic today. So take home message for me is, when you are planning next session, please, before you put on your slides for your presentation, of course you have to read and find out what is the content and all those things. You put 5 minutes aside and say, okay, 2 minutes I'm going to do introduction, and this is what I'm going to do introduction. Another 5 minutes I'm talking about basic sciences. These are the different things I'm talking in basic sciences. I will ask this question, which probably would be benefit to the junior ones. And then 10 minutes later, I'll be asking this question or putting this photo up, which may be more useful for the intermediate ones. And then I'll ask this. So think of your audience range as well. This group is a wide range, isn't it? And let's see how you do it. And if it was helpful, let me know. If you struggle to plan, let me know, so we can sit down together and then do a proper planning, because this skill is expected from you. It's not something nice to have type of a skill. Now, it is there in the curriculum, and it is true that as an emergency medicine consultant, you would be teaching training every day on the soft floor, maybe on this type of formal session, maybe while you are helping them to pull an ankle or a wrist or a shoulder. You are a trainer, teacher everywhere. So you even putting a small cannula or teaching about blood gas, this teaching training skill has to be important. Listening to juniors' history. So let's develop this skill and see how we do. Any questions before I finish?
I think it's where we are. I think it's important, as Prakash is saying now, so you have to think that what really you would like to, teach the audience. So that's very important in your head. And the second point is, it's like anything, is you have to be systematic. You can't investigate or operate on a person before taking history or examination. So it has to be systematic, the topic. And the other thing is that there are to my head, there are two main topics we teach. One is a topic in itself. So, of course, for example, if there's airway obstruction, so there are a lot of differential diagnosis of airway obstruction. So, so we don't, if we go into that detail, then everything will be confused. So, so we have to say like airway obstruction, how it comes, what symptom and sign, what the reason, what the differential diagnosis, something like that. Like we see the patient. So one of the teaching is that sort of topic. And another topic might well be like blood gases. Now, blood gases, it's very difficult to expand on that. But inherently, blood gases need understanding of physiology behind that, the science behind that. So, of course, you have to say what is pH, what the physiology of pH, what the pathology of pH, what the PCO2, PO2. So there are different topics really when you plan to teach. So hence you expand in that way. So it's a science really. Teaching is a science. It's an MSc, PhD, everything. So I think we should take it as a science. It's a very, very unique skill. People who have this skill, it's very good for them.
So guys, when you open your Kaizen, just write something about today's session as one para reflection and connect it to SLO9. So that later on, when you're sending your seizure application, SLO9, you have at least started touching it. Okay. So maybe you might have taken one take-home message. You can just write that take-home message. So today we had a session on this. This is what I learned. And next time when I do a teaching, this is what I'm going to implement or use this knowledge for. And if you just type it and put it there. If you don't have any questions, I've finished my session 3 minutes early.
Okay, so if we don't have any question, then we'll go to next session. So I'll stop here.